Again, rather, the reason so many don't have health insurance is their low educational attainment. There is no single better predictor of how an immigrant is going to do in the modern American economy than their education levels. And this is true whether we were to look at welfare use, income, home ownership, or health insurance coverage. Now, so far I've only talked about all immigrants and their kids, but what about legal status? In an earlier study, we've estimated that 64% of illegal immigrants are uninsured, and they account for about 1 out of 7 people in the United States without health insurance. And if we were to count their U.S.-born children, then it's more like 1 out of every 6 people without health insurance in the United States is an illegal immigrant. So these are some big numbers, but it's not, again, the whole story. Again, about 7 million uninsured illegal immigrants. That number's about 8 million when we count their U.S. children. Now, what about the costs? Because that's what I think a lot of folks are concerned about. Now, we are in the process of trying to develop some more precise estimates, but right now our best estimate is that we're spending about $4 billion a year providing health care to illegal immigrants. Now, that is just public expenditures, $4 billion. It's a little more if you count their U.S.-born children. Now, it is also important to note that uninsured illegal immigrants use significantly less in health care than uninsured native-born Americans. They're just dramatically more likely to be uninsured in the first place. This is because they tend to be younger than native-born Americans, and so health care costs generally rise with age. The illegals are relatively young, so they tend to cost less than uninsured natives. They're just much more likely to be uninsured in the first place. Also, although the stereotype is that illegal immigrants go to the emergency rooms all the time, very often, this is not really correct. The problems illegal immigrants create for emergency rooms is not so much that they go more often than the rest of the population. Rather, it is that when they go, they are much more likely not to pay. And that's why it's a problem. Remember, 13% of native-born Americans are uninsured, so they pay the vast majority of the time. But more than 60% of illegal immigrants are uninsured, so they often don't pay. Thus, when illegal immigrants use emergency health care, there is often no corresponding stream of revenue going to the emergency room to offset all the costs they create. This is the reason emergency rooms get so overcrowded in areas with lots of illegal immigrants. Illegal immigrants are using the system without paying for the system at much higher levels. We can also calculate the cost to taxpayers of the whole thing, of what legal and illegal immigrants cost, and if we put in their U.S.-born children who are uninsured as well, and that's about $11 billion a year from public coffers. Now, charity and the illegals themselves and the immigrants themselves pay on top of that, but the cost to taxpayers from all immigrants who are uninsured and their U.S.-born children, we're estimating at about $11 billion a year, and this takes into account that the immigrants tend to be younger and use less care, but are, of course, much more likely to be uninsured in the first place. Now, what if we tried to provide Medicaid to, say, uninsured immigrants? In that case, the cost would be very high indeed. If we decided to cover just the uninsured illegal immigrants with Medicaid, even taking into account their much younger age on average, it would still cost about $15 to $30 billion a year to provide them directly with Medicaid. Now, providing Medicaid to all uninsured immigrants and their children would, of course, be enormously expensive, perhaps $60 billion a year. Now, what about an amnesty, or what some folks like to call legalization of illegal immigrants? Would that solve our problem? That's an interesting question. The president has made statements that suggest that he thinks an amnesty would solve our problem. But the answer is no, it almost certainly would not. Remember, lack of health insurance is very common among legal immigrants, people who are here legally. In 2007, more than 1/4 of those with a green card, that is a legal resident who's not a citizen, did not have health insurance. That's more than twice the rate for native-born Americans. If we look at green card holders who don't have a lot of education, which then is analogous to the illegal immigrants, or what the illegal immigrants would become if we gave them legal status, 35% are uninsured. Now, this is better than the 64% that we estimated for illegals. So in that sense, we think that more illegal immigrants would have health insurance, but there's a catch. If we, again, look at those less educated green card holders, in addition to 35% being uninsured, another 28% on Medicaid, the health insurance program for the poor that's very costly for the government. Which means we haven't really solved the cost problem because we didn't solve the underlying problem, which was that illegal immigrants are overwhelmingly unskilled. Not in every case. There's certainly skilled immigrants, but we think that about 80%, say, for example, have no education beyond college. A majority haven't even graduated, no education beyond high school. And we think that a majority haven't even graduated high school, about 55%, and about 80% are either high school dropouts or have only a high school education. In conclusion, we have to ask the question, can we have health care reform without immigration reform? Put a different way, can you let illegal immigrants stay and avoid the large cost for taxpayers? The answer is almost certainly no. If the illegals stay, the costs will stay as well. In short, we either enforce the law and reduce the illegal population over time, or we just accept the costs, which is another alternative. Now, if one still favors an amnesty or legalization, whatever you'd like to call it, then we have to be honest and make it clear that in areas like healthcare, the costs are significant for letting the illegals stay and may actually get quite a bit bigger if we legalize them. It doesn't solve the cost problem. As for legal immigration, obviously legal immigrants already here are free to stay, of course. But in the future, we have to decide whether it makes sense to continue to allow in so many legal immigrants who don't have a lot of education. Depending on how you calculate, some research shows a quarter of legal immigrants haven't graduated high school, and some research shows a third haven't graduated from high school. So a very large fraction of the legal immigrant flow is what can be described as quite unskilled. At present, most legal immigrants are allowed in the country because they have a relative here. This means that most legal immigrants are selected without regard to their education or their impact on taxpayers or the healthcare system. If we want to avoid large costs for taxpayers in the healthcare system, we would need to significantly reduce the number of legal immigrants who are allowed in the future who have very little education. Now, I think there's still one final point that bears mentioning. The large share of legal immigrants on Medicaid or the large share of illegal immigrants without health insurance should not be seen as some kind of moral defect on the part of immigrants. The vast majority of immigrants, legal or illegal, do not come to the United States to get free health care or to sign up for welfare programs, though that often does happen. And of course, as I've already pointed out, the vast majority of immigrants, including those here without health insurance, hold a job, they work. Rather, the problems I have discussed are an unavoidable consequence of allowing a large number of immigrants who work but have very little education, and as a result, they, or often their children, are uninsured or use a welfare program like Medicaid. If we want to reduce the uninsured population and avoid large costs for taxpayers in the healthcare system, we need to enforce immigration laws and reduce illegal immigrants, number of illegal immigrants in the country. And on legal immigration, moving forward in the future, we would need to allow in many fewer immigrants who have little education. Barring those two changes, immigration will continue to have a very large impact on our healthcare system, creating lots of folks who are uninsured, lots of folks who need Medicaid, with a cascading series of consequences for the system. Thank you.